You all must have heard headlines about a 3D printed capsule destined for use in assisted suicide, hoping to operate in Switzerland. Exit International, which is an international non-profit organization advocating legalization of voluntary euthanasia and assisted suicide, the organization has developed the Sarco machine. Now, the question arises in our minds is what actually is assisted suicide or voluntary euthanasia? Euthanasia and physician assisted suicide refers to deliberate action taken with the intention of ending a life in order to relieve persistent suffering. There are two procedural classification of euthanasia. Passive euthanasia, which is intentionally letting a patient die by withholding artificial life support, such as a ventilator or a feeding tube. Active euthanasia is when someone uses a lethal substances for forces to end a patient's life, whether by the patient or by somebody else. Active euthanasia is more controversial and it is more likely to involve religious, moral, ethical, and compassionate arguments. Now, understanding about euthanasia would lead us to a deeper thought towards the Hippocratic Oath. The original oath, which is included, among other things, the following words: I will neither give a deadly drug to anybody who asks for it, nor will I make a suggestion to this effect. But the modern oath requires variations as the world has changed since the time of Hippocrates. Some feel that the original oath is outdated and demands its inclusivity towards euthanasia. So, after getting a good understanding about euthanasia, let's get back to India and answer certain questions like, is euthanasia even legal in India? And if it's legal, what kind of euthanasia and how was the journey? Euthanasia in India dates back to 1971 when the Law Commission of India Report number 42 recommended the deletion of section 309 of the Penal Code 1860, attempt to commit suicide for the first time. In 1994, the case of Rathinam versus Union of India, the Supreme Court held that Section 309 IPC violates Article 21 of the Constitution, explaining protection of life and personal liberty. But in 1996, the Supreme Court's Constitution bench in Jian Kaur versus Punjab held that right to life conflicts with right to die, as does death with life, overruling 1994 judgment. The actual spark for legalizing euthanasia lit after Supreme Court in 2005 notes a PIL from NGO Common Cause urging consent to passive euthanasia for terminally ill persons. The petition seeks the center's response on the contention that right to die with dignity should be declared a fundamental right under Article 21, right to life of the Constitution. It also prayed the court to issue directions to the union government to allow terminally ill patients to execute living wills for appropriate action in the event that they are admitted to the hospitals. On February 25, 2014, a three-judge bench of the Supreme Court comprising the then CJI P. Sathasavan, Ranjan Gogoi and Shivakirti Singh had referred the matter to a larger bench to settle the issue in the light of inconsistent opinions in Aruna Ramchandra Shanbag versus Union of India 2011 case. On March 9, 2018, a five-judge bench comprising Deepak Mishra, A.K. Sikri, A.M. Khanvilkar, D.Y. Chandrachud and Ashok Bhushan held that the right to die with dignity is a fundamental right. An individual's right to execute advanced medical directives is an assertion of the right to bodily integrity and self-determination and does not depend on any recognition or legislation by a state, thus legalizing passive euthanasia in India. Even though Common Cause versus Union of India became a landmark judgment to legalize passive euthanasia and execution of living will, the case of Aruna Ramchandra Shanbag is still considered a guiding light. Reason being the center of attention, this case of euthanasia after spending nearly 42 years in a vegetative state as a result of a sexual assault. Shanbag was assaulted by a ward boy, Sohanlal Bharta Valmiki, and remained in vegetative state following the assault. On 24th January 2011, after Shanbag had been in the state for 37 years, the Supreme Court of India responded to a plea for euthanasia filed by journalist Pinky Virani, setting up a medical panel to examine her. The court rejected the petition on 7th March 2011. Her case became the focus of India's euthanasia debate. Her deeply heartbreaking tragedy focused attention on her right to live or die, but it also touched on a number of related social, ethical, legal, medical, sexual, and religious issues.